Welcome back, everybody, to another episode of Outside the Box. I'm with Performance Medicine's Operation Manager, Katie Geagley. Katie, how are you doing today?
I'm good. How are you?
I'm great, and we're going to go over a very specific topic today, as we always do with you. We're going on the back end of hormone therapy and what that means for patients who are wanting to do something like this at Performance Medicine. So, Katie, talk to me about how to become a hormone therapy patient at Performance Medicine.
Okay. So the first thing you should do is come in and get a male or female hormone panel. You can do that in any of our offices, Monday through Friday, 9 to 12, and then 1:30 to 4:30. Or you can go somewhere else. You can give our office a call, and we can send you a lab order via email or to the destination you would like to go. If you're not from around here or have a lab closer to you, we can definitely do that. We ask that you do that just because when you come in for your appointment, you get more out of your appointment because the provider is able to see where your levels are and they can start treatment that day. And then once you have in your lab work, if you get it from a Performance Medicine, it takes about 1 week to get in, and then we'll schedule you an appointment. We unfortunately right now cannot get you in within that first week, but we can get you in shortly, or you can call and schedule an appointment now and then come in a week before your appointment. We just ask for the week to make sure you have everything and everything's back in, because you don't want to have an appointment without your labs. Once you have your first consult with one of our providers, you'll follow up with a lab panel in 2 or 3 months and an appointment to follow. That just makes sure you're where you need to be. Do we need to increase? Do we need to decrease? Do you like it? Do you not like it? What's the best course of action? Is that cream? Is it shots? Or is it pellets? And we offer all the above. Shots you can do weekly in our office if you're a man or female. We've been doing a lot of female T-shots. But say you don't have time to come into the office once a week, we do offer self-injection for male or females. That just means you give your shots weekly at home, or you have someone do it for you at home. So what's the best process to come in and get lab work? Our paperwork is available on our website at performancemedicine.net. This cuts down on you having to wait in the lobby while you fill out the paperwork. Usually if you bring in that paperwork with you when you come in to get labs, you can just hand it to one of our receptionists. They'll get you back, get your chart, and you're usually in and out in under 30 minutes. I don't think I've ever seen anyone it take 30 minutes, but that's just a safety net for us. And then you do not have to have an appointment. You just walk in for any of our labs.
So real quick, tell me the time frames one more time. So I come in and I get my labs. That doesn't require an appointment.
Nope.
Then I schedule my appointment once my lab results are in. So with that first appointment, the provider and the patient will go over the results, talk about different options. And then from there, the provider kind of sets the schedule. Is that how it works?
Yes, sir. Because different people, of course, we're not cookie cutter. Each patient is different. Each treatment is different for the patient. We do, if you come in for the labs, we'll schedule you for your appointment at checkout, so you don't have to wait until your labs are back. If your labs, come in before your appointment, one of our nurses do give you a call to let you know what those labs say. So you don't have to wait until your appointment, which is very nice.
If I'm a self-injector, I'm coming in, that's every 3 months for a follow-up.
Yes, sir.
And I know pellets are, they kind of, there's a range of them, but generally speaking, I'm coming in how many times for female and male?
For females, between 3 and 5 months. I do have a couple patients that come in every 6 as a female. It really depends on your body and, what you do activity-wise. For men, it's usually 5.5 to 6 months for the pellets. Cream-wise, and like people that come in weekly for T-shots, we usually do every 6 months unless there is a change. If there's a change, you're going to follow up at 3 months from that change.
What would make for a change? Why would somebody need a change in particular?
Well, if their labs weren't reading the way our providers like if they're still low, we'll adjust that cream or we'll adjust the T-shot. Or if you're having symptoms and not doing well and we make a change, we like to see you back.
Katie Geagley, you have gone with us through how to become a patient at Performance Medicine for hormone therapy. Katie, I can't tell you how much I appreciate this.
Thanks, man.
Don't go away.